webinar, Dietary and Herbal Treatments for IBS. Big subject, very tricky condition to treat. You know, this is, of course, we could describe IBS as a continuous inflammation of the intestinal mucosa, often including the anus and rectum as well. Basically, it's a collection of symptoms or a syndrome compared to a disease. We're going to cover the different types according to Ayurveda. We're going to cover the different causes, which there are many. We're going to cover signs and symptoms. We're going to cover the different categories and progression. We're going to cover the dietary guidelines, and we're going to go over the herbal products. And some of these herbs are so rare, even good Ayurveda doctors never heard of them. And they're hard to get. I have to fly them in from India. So the herbs are quite tricky. I did learn this from my teacher in India, and I spent a couple of years going to India, sitting by his side. And I remember there was many conditions I, of course, learned from him. But I remember that IBS, he was at the time, 7 years ago, very good at IBS and ulcerative colitis and irritable bowel conditions. And he was getting people from all over India. So then at the time, he was doing a lot of cases, and I learned from him. So like I said, it's a collection of symptoms and not a disease. And according to Ayurveda, there's two types. There's Vata pushing Pitta and Pitta pushing Kapha. So we can just break that down in simple terms as the Vata type, and there's a Pitta type, because that's generally what I see and how I see it. You know, there's two types. From the Ayurvedic perspective, I don't think Western medicine really has a very good understanding of how to manage this condition. The diet that they recommend doesn't seem to be effective, and some of the medicine can be quite harmful. So I do get a lot of cases because it's very difficult for people to treat on their own. A lot of people struggle for a long time, months, years, even decades. And we see a lot of symptoms like unable to digest dairy, unable to digest wheat, unable to digest all types of foods. And of course, pain, inflammation, abdominal pain, diarrhea, loose stools, etc. But let me start with some of the causes. And the causes, I think some are quite surprising to people. They're surprised by some of these causes because they don't think that they've caused the health problem. There's two types again. So the Vata type, which is for a person who's dry, light, thin, cold. You know, the Vata diet is a Vata increasing diet, not a Vata pacifying diet, but a Vata increasing diet can really lead to this condition. What's that in simple terms? Dry foods, dry crackers, dry nuts, beans, particularly large beans, pinto beans, navy bean, lima bean, and peas, because these are colon irritants. They have, these, phyto and anti-nutrients on the skin that are undigestible, kind of like the egg on the shell on an egg. And that's why we have to soak beans, and that's why we're able to digest legumes with no skin, or we take the husk off and it makes them easier to digest. But these large beans in particular are colon irritants. You get gas, you get bloating from them. And of course, excess consumption of beans increases Vata, colon irritation. And also raw vegetables, particularly the cabbage family, cabbage, broccoli, cauliflower, kale. That's right. I have had quite a few young people who were smoothie people and doing kale smoothies for a long period of time, until the point they had actually ulceration of the colon and had bleeding in the colon. So crackers, nuts, dried foods, particularly dried chips, and raw vegetables, and of course beans. These are all Vata increasing. They're very raw. They're very big colon irritants. And now, of course, we know with the cruciferous family, they have high in sulfur, and the sulfur is a colon irritant, why we get flatulence and bloating from it. So that's probably one of the major causes of the Vata type. The second type, the Pitta type, of course, the Pitta type of person is a warm, sharp, slightly oily in nature, and too much hot foods, chili pepper, cayenne pepper, black pepper, red chili pepper in particular, are a cause. So when we get people who are, Pakistani, Indian, from Mexico, using cayenne pepper, chili pepper, a lot of black pepper, combined with alcohol. This also increases pitta in the intestines, alcohol, hot spices, and then pungent foods like this, we call them pungent things, will create the pitta type of IBS. And also, of course, it's usually the case there's multiple causes, which makes it quite tricky to treat. And of course, with Ayurveda, we have to know all these causes to be able to treat it, because we're removing causes. The first line of treatment in Ayurveda is remove the cause. That's not the case in allopathic medication. I know many diabetics who are still having sweets, so they've never even removed the cause. I know many people with insomnia still drinking coffee. They haven't removed the cause. So this is very typical, to try to treat your condition and not remove the cause. Even herbalists make this mistake. They say, oh, take this herb for your high blood pressure, but they don't know why the blood pressure is high. Or take this, for your kidneys, but they don't know why the kidneys are, creatine levels high, uric acid's high, kidneys are failing, GFR is low. They don't know what the cause is, but they're trying to treat it. So, of course, this is not fully professional individual, not thinking in a holistic manner, still trying to just treat symptoms and not understand causes. But it's very difficult to understand causes. You have to spend a lot of time. You have to have good diagnostic skills. You have to ask people a lot of questions about their health history. You have to add a lot of details about their diet. And you have to be good at diagnosing them through observation, touching, skin, pulse, tongue, etc. So another cause is antibiotic use. Of course, we know this is an inflammatory colon condition. We'll just call it from now on an inflammatory colon condition. There's all different degrees or stages, we could say, which we're going to talk about in a minute. And there's often multiple causes. So what stage a person's in, how advanced it is important, whether it's vata pushing pitta or pitta pushing kapha, and what are these causes. So one cause is antibiotic use, because this destroys your intestinal flora, protecting your colon and your intestinal lining, and this can be one of the causes. So if you have a long history of taking antibiotics and you have many of these signs and symptoms, that is probably one of the causes. So of course, probiotics is part of the treatment. And then of course, there's other causes, endotoxins, environmental toxins, particularly heavy metal toxicity, a real wild card out there, difficult to test until people do the test. Sometimes, when conditions are not improving on their own, then we see the heavy metal toxicity is one of the causes. Parasites is also a very tricky cause. We often end up managing the condition, but then we have to go back to treating the parasites, then back to managing the condition, because the anti-parasitical herbs are generally too strong for somebody to take when they have IBS. So if one of the causes is parasites, you still have to manage it so they can eat, bring down the pain, bring down the inflammation. They have to go back and treat the parasites, and at the same time be careful not to aggravate the colon lining again. Now, the main causes, of course, are dietary, as I mentioned earlier, vata increasing foods for a vata prakriti, pitta increasing foods for a pitta prakriti. But also there's particular foods that aggravate the colon and can lead to this condition more than other foods. And number one is coffee. Number two is chocolate. So, and number three is raw vegetables, particularly, as I mentioned, the cabbage family. And that's for vata types. If you're pitta type and you already are warm, your prakriti is pitta, you're a warm person, strong digestion, tend to have loose stools, then, having hot spices, chili pepper, and tomato sauce. Tomato sauce particularly can be inflammatory and make this condition worse. Also, the excessive use of laxatives, whether it's medical or herbal, many people do take senna. You can find senna capsules in the store, and the senna of course, any trained herbalist knows not to give senna all by itself. It's a big colon irritant. But people do it for long periods of time. But mostly it's the pharmaceutical laxatives that really cause this problem. So there are many causes. You have to identify these causes. Of course, you have to change the diet. Sometimes you have to add antibiotics and probiotics in there. Oh, one other cause I forgot to mention was radiation. Too much radiation treatment can also just destroy your intestinal flora like the antibiotics do. So these are harder to remove, but then you have to restore that intestinal flora when you've had radiation treatments, you've had antibiotic treatments over a period of time. So the treatment is really different for every person. There's really no person who's getting the same IBS treatment. That's why it took me so many years to learn, because I had to have multiple cases. Every time I thought I understood it, then I was with my teacher in India and Chandigarh, and there was another type of case, another stage. So signs and symptoms for the Vata type, it's gas, bloating, headaches, fatigue, and starts usually with constipation and starts to progress into loose stools for the first time in their life, because they generally have a history of constipation, dry, hard stools. But those dry, hard stools, that raw vegetable, raw kale, nuts, cracker, decades of constipation, and throw in antibiotics there, then you've roughed up and over detoxified your intestinal lining with all these raw vegetables, and then the antibiotics have damaged the intestinal flora, and so this combination together is very common. For Pitta types, signs and symptoms are diarrhea. Pitta types of people generally have good bowel movements, more sometimes almost leaning on the loose side. So they could have loose bowel movements their whole life, and then suddenly they start having diarrhea, nausea, burning in the anus area, temporal headaches right around the eyes, and both types can have abdominal pain and start to have a lot of food restrictions. That's one of the first signs and symptoms that you see. Oh, I can't eat wheat, I can't eat dairy, particularly if you eat some fermented dairy like yogurt, or milk, and then you get diarrhea from it. You drink milk and you were drinking it before, even it may not be maybe you were drinking homogenized and pasteurized milk in the past, you had no trouble. I personally don't have homogenized and pasteurized milk. I drink organic raw milk with the cream. And because homogenization makes it difficult to digest, pasteurization destroys all the healthy intestinal bacteria that helps you digest. So, but people were drinking unraw milk in the past, no problem. Now even they have raw milk, they have a problem. But if you have milk or a dairy and you get diarrhea, that's early sign. Wheat intolerance, also early sign. Of course, we tend to blame the wheat. Oh, it's the wheat's fault. The wheat is bad. And there's many books on this. And of course, the pesticides and chemicals in the wheat, definitely are an irritating, inflammatory part of the inflammation due to those endotoxins in the pesticides. But you see other people eating the same wheat and they're not getting diarrhea and cramping and pain. I mean, if it was truly problem of the wheat or the milk, then everybody should get it. I mean, if something's poisonous, no matter who takes it, they're going to be poisoned. But when only you have the reaction, the whole rest of your family's eating pizza, and it may not be healthy, but they can eat it, and you cannot drink any milk anymore, but you did in the past. Vatas generally don't do very well with milk anyway, so if you're Vata and you can't have milk, no big deal there. But butter, soft cheeses, little yogurt should be fine for Vata. If you can't even have soft cheese, then this is an issue. If you were having wheat your whole life, but now you get a big reaction, particularly diarrhea, then this is the beginning of the inflammatory condition. So we'll talk about these categories or stages. The first stage is basically inability to eat certain foods, particularly wheat and dairy, difficult to digest foods, and more gas and bloating. Then we could say the next stage is like spastic colon. There's more cramping and pain. And then you start to get loose stools if you're Vata, even though you have a history of constipation. Now you're starting to get loose stools. You're kind of like alternating constipation, loose. Now you're into like a second stage. First, you couldn't eat a bunch of foods. Now you're getting constipated and loose stools. For if you're Pitta type, you start getting diarrhea. You had a whole history of you used to be able to eat chili peppers and hot sauce. Now you can't have it at all. Now you get diarrhea really easy, even with tomato sauce and pickles and anything hot. Now is giving you diarrhea. You're now in second stage. And then of course, next stage, ultimately, there's different levels even at that. But ultimately, you can get ulcerative colitis where there is bleeding out of the rectum. And that is another subject, the treatment for ulcerative colitis. Once bleeding is involved, this is more of a Pitta condition. And of course, the treatment does vary quite a bit. The real trick here, we're going to do dietary guidelines next. And really, I try to vary these dietary guidelines based on the individual. Because each individual, of course, you either have a Vata condition, you have a Pitta condition, and you could be in a certain stage. So if you're just in the early stages, you can actually just change the diet and maybe some mild, gentle, digestive herbs and, some anti-inflammatory, intestinal anti-inflammatory herbs and solve it in the early stages. In the later stages, once you start to have chronic diarrhea, particularly 5-6 times a day, or you're having a lot alternating between diarrhea and loose stools, and you can hardly eat anything, these are later stages. So you're going to have to be more strict with the diet. And I'm going to go over some of the general dietary guidelines. But remember, in per Ayurveda, they could be greatly different between the Vata person and the Pitta person, and they could also vary greatly between depending on what stage the person's at. I try not to do very restrictive diets because this makes it more difficult for people to follow. I don't just have a one diet for any condition. I try to restrict the foods that absolutely must be restricted, and certain things that aren't going to make a big difference, I'd soon just let it go. So any type of diet out of a book will never work. It really has to be individualized for the person. And like I said, there's these two major types. This Vata person has dry, hard stools historically, and the Pitta person who tends to have, kind of loose and soft stools historically, and they will have different causes and different treatments and different herbs and different diets. So those are the two main categories in Ayurveda, and that's the beauty of Ayurveda. They categorize everybody different. You could have 5 people with high blood pressure sitting in front of me, and I give all 5 people different herbs because there's many causes to high blood pressure. It could be coffee pushes up your blood pressure, blockages in kidney push up your blood pressure. Anxiety and worry in your life can push up your blood pressure. Cardiovascular blockage can push up your blood pressure. Thick blood, high lipid levels can push up your blood pressure. So there's many causes. And so you could have 5 people all having high blood pressure, and you could end up treating them completely different with totally different herbs, totally different diet. One person could be thin with high blood pressure. Other person could be obese with high blood pressure. So you can't say there's a high blood pressure diet. There's no such thing. You're just no longer at the professional level where you're able to individualize things for people. And this is, of course, why in my practice, using the power of Ayurveda, the individualization of Ayurvedic dietary system, I have such a high success rate. I can only thank Ayurveda for that. So that said, we're still going to cover general foods that you can eliminate and general foods that will be beneficial. So it's general. It's just one of these conditions you just got to work with somebody who has experience, who's climbed the mountain a few times and done it. You're not going to wing it. This diet, this treatment, it's almost, people struggle with it literally for decades. And then, I've been up the mountain, I've been down the mountain, I've been back up the mountain, I've been around the back of the mountain, I've been up and down with storms, and I know how to climb this mountain now. So you need that kind of guide, that kind of experience. And I have the tools. I have a lot of herbs, a lot of products, and I give each person a different set of herbs. And even as they're progressing on the condition, the herbs are having to change and the diet's having to change. It's just a big moving process. In fact, most of these people with IBS, I can't let them go a month without another appointment, because they're going to change so much after the initial dietary guidelines and herbs that, I have to see them like every 2 weeks. I have to tell them, you got to come every 2 weeks. You can't go every month. I mean, for weight loss, I let them go a couple months. If they're losing 10, 15 pounds a month, great. Just keep on going. See you in 3 months or until you stop losing weight, but not for IBS, irritable bowel, particularly ulcerative colitis. We have to meet, every couple weeks, if not more, if they can do it, so I can keep adjusting the herbs, keep adjusting the diet. Another big problem, of course, people have is when you can't eat everything and everything is painful, you don't eat much and you start losing weight really fast. So most of the cases that have come to me have been underweight, depleted, bony, weak, and bedridden, and completely unable to work. I've even had quite a few that, went to ER a couple times first before they saw me. So that said, diet is very tricky here. But we will say there's no raw vegetables. There's no cabbage family. Cabbage, broccoli, cauliflower, kale, Brussels sprouts, even cooked. Now, once you recover, then, you can have some of these cooked, particularly if you're pitta. But if you're vata, you should never consume these even in big quantities cooked, this cabbage family. And if you're pitta or vata, but particularly pitta, you shouldn't have nightshades, tomatoes, eggplants, bell pepper, paprika, white potatoes. These should all be removed because they are inflammatory. Also, you should remove all foods that are hard. Ayurveda doesn't speak in terms of raw or not raw. They speak in terms of hard and soft. So no hard carrots, no hard nuts. So it's not to say you can't have carrot. You just have to have carrot soup or steamed soft carrots. You can't. It's not that you can't have nuts. You have to soak them and make them soft. Take the skin off, blanch them. So all foods have to be soft. Safe foods are asparagus, green beans, all the squash, zucchini, pumpkin, all safe. There's no lettuce. There's no salads. There's no cabbage family. And also you avoid most sour things, pickles, vinegar, and do sweet. And see, sweet is very helpful. Sweet fruits, even sweet fruit juices. I recommend pear juice, mango juice, coconut water. These are all cooling and demulcents, lining the intestines. So you have to understand this diet is not a nutritional diet. Many people, don't like it, don't want to follow it, don't follow it long enough. In fact, nobody has followed it long enough, including the medical doctor who I got a testimonial from. We can see him right here. I'll just flip over to that real quick. I'm jumping around here, but screen number 2. Let's see how this goes. There we go. So this, if you go to my website, you go to testimonials right there, go down. These are all, I have almost 400 testimonials. If you go to colon related, you can see right there, colon related testimonials. First one, IBS better in 3 days. She also had a stomach ulcer in IBS. She went to ER, and herbs and teas helped her within 3 days. No more pain. Huge improvements. Already I'm under a week into this. Thanks for all your help. Here's another one there. I don't know if it was IBS. This one, she had, of course, a lot of pain, diarrhea. It's a video. But this is the one I want to show you. This is the one from the medical doctor, who was a medical doctor for 39 years. And he had ulcerative colitis, and he went to the hospital, Cedars-Sinai Hospital, one of the top hospitals for ulcerative colitis. And they gave him prednisone and this specific carbohydrate diet, which I don't recommend. And when he came off, a month later, it was apparently worse, bloody, diarrhea, gas, abdominal pain, came back. And then they wanted to give him Remicade, which I'm not familiar with, but being a medical doctor, he said he was fully aware of the horrendous side effects of Remicade. So refused it, found me somehow. I told him what to eat, what not to eat. He followed the treatment. Diarrhea resolved in 2 or 3 days. blood in the stool and excess gas continued. Took him up to 8 weeks. This was really a serious case because he didn't treat it right for such a long time. But he did make the mistake, which almost everybody makes when I treat them for IBS. They get such fast results. They stopped the herbs, started to go into the forbidden foods and spices, as he says. And then a month later, not right away, he paid the price. Symptoms reoccurred, but only mildly. Went back on the foods and allowed food, back on the herbs and the allowed foods and spices. Symptoms resolved. And that was back in, I mean, that's like 2018, 2019 or something like that. So, and there are more testimonials in this category. No more pain, much more energy. So we do get a lot of testimonials regarding that. So I thought that would be of interest to you. But what I find a good point here is that almost nobody, including the medical doctor, who was really a good patient. I mean, he really tried hard. He was really serious. I mean, he did a good job, but he relaxed. And every single person I've had so far, nobody has not made this mistake. It must just be human nature. They get the herbs, they get on the diet, and then they feel better in days, like you saw from the testimonials, or weeks. And then they get off the diet, they forget about the herbs, and the whole situation comes back. That's because they didn't allow the intestinal lining long enough to heal. So there's even a few stages of the treatment. First, we just try to manage it so the person can eat, stop losing weight, have no pain, no inflammation. That's just the management part. And some people think at that point, or actually everybody, including the medical doctor, thought that was the treatment. He was done. It was over. No, I had just managed it so they didn't have pain and they would stop losing weight. So there are these 3 stages of treatment. That's the first stage, management. Unfortunately, most people just stop and then they have reoccurrence. And, you know, I usually have people on second time. I've had some people go through this process 3 times where they started the herbs, felt better, forgot about the diet, got worse, and came back and followed the diet and stuck to it second time, sometimes even the third time. And some people just even couldn't do it. And it was just overwhelming for them because they were just all confused why it was getting better and worse. And it was basically, they just weren't sticking to the plan long enough to let me get through my 3 stages. Manage it, heal it, and then long-term diet to make sure it doesn't come back. So very few people make it even to the 3rd stage. So they do the first stage, managed, then they forget about it, comes back once or twice. Then I keep emphasizing, hey, I need to go longer. 2 weeks isn't enough. I need a month on this diet. This time, be good, stick to the herbs, and we will get through it. So that they get through the 2nd stage, and then it's healed. Then they usually forget about me, and they don't even get the guidelines that they could do the 3rd stage. Nobody gets to the 3rd stage because they're already happy. They're already sending me the testimonial, thanking me. And I haven't even finished yet. But, you know, this is typical for me and many of my treatments. You know, I have follow-up stages, a restorative stage, like I detoxify people, get all the toxins out, the heavy metals out. They thank me, all the symptoms go away, and then they disappear. But in fact, I have a 2nd stage of restoring and rebuilding and rejuvenating the body after the 6 months of treatment. But most people don't hang around for that. And this is a big problem with IBS. Fortunately, you know, the pain brings them back. So that is what happens. I've seen it many, many, many times. Even when I warn the clients that this could be reoccurring if you don't stick with it for long enough, even when I warn them, they feel so much better. It happens again. So let's go back to the diet a little bit more details. No pickles. This is, of course, no chili pepper, no cayenne pepper, not even black pepper. Sometimes people can't even do ginger, or, you know, there's no, like I said, no tomatoes, no nightshades. You're basically eating bland baby food. And another, that's how I tell them after 30 minutes of describing the diet. And again, I will give, if it's about a person who's got alternating constipation and diarrhea, I will give them one diet. And if it's a pitta person who's hot and warm and just, you know, multiple loose stools and diarrhea, I will give them still a different diet, and or at least emphasize some should be absolutely avoided forever. Now, one tricky part of the diet, which people really don't like, because there's a lot of meat eaters in this world, is that I have to get them off the meat. And they don't really understand that, and so they start craving the meat, and that's probably how they deviate off. Some people just go back to the spices. Some people go back to their raw vegetables too soon. But the most common is they go off to the meat, because we really put them on a khichdi diet. And if you're familiar with mung dal, this is organic mung dal, split yellow mung dal, not the green whole mung. So we put them on split mung. And if they're having diarrhea and loose stools in their pitta, with white basmati rice, not brown basmati rice. And if they're having more like alternating constipation and the more vata, then we put brown basmati rice, mix 50-50 with the mung dal, with very mild spices like fennel, coriander, cumin, dill, no chili pepper, no black pepper, no mustard, no garlic, no onion, nothing like that for most of the people. And so it's a really bland diet. And that rice and mung dal is just to keep a person alive while I'm treating them. Then they can have the soft, mushy vegetables, like I said, squash, zucchini, pumpkin, asparagus, green beans, and sweet potato. These are all fine. And then they can have sweet fruits between the meals. No sour fruits, no dried fruits, but no apples, no pears. But they can have most berries, blueberries, and one of the best is actually mango and soft pear over ripe pear. So, it's a very weird diet. People don't really love eating bland, mushy food and having no spice, no sour, but it's necessary, and it does give them relief quite quickly, and it keeps them alive because you're getting enough protein from the mung dal. Of course, in our society, we believe we must have a lot more protein, but we actually have, if I do say that, excess protein. Most Westerners are over consuming protein. We're kind of obsessed with protein powders, we call meat protein. But actually, if we look at the statistics worldwide of the World Health Organization, not really an organization I respect, but they probably got a few numbers right, that 70% of the world's population is getting their protein from legumes. That's 70% of the world. That's all the third world, all Central Asia. They're all living off of legumes. And for that matter, me too. Legumes are, of course, have many advantages. One, it's very hard to have excess protein if you're living off of legumes. And we know that excess protein can lead to kidney failure, growths, tumor cysts, fibroids, and is a more major contributor to cancer. And there's no fiber, and it can be quite constipating. But people do get used to it. People are not used to having dals or mung dal. And mung dal is the only dal they can have, because almost all of the beans make the condition worse. So unfortunately, a lot of people, particularly Vata Prakriti type people, believe, I can't have any beans, I can't eat beans, but they've never had mung dal. It's like a lot of people panic, I can't have dairy. And I say, what about butter? Oh, butter's okay. Well, butter is dairy. So we do give ghee. You have to have ghee on this. There's now, if you're Vata type, not Pitta type, we give buttermilk too, which is like a little yogurt with a little warm water, but not too much. You can't have bowls of yogurt. You can't do crazy food combining like yogurt and fruit and things like that. Poor food combining also can lead to this problem. But buttermilk helps with IBS, but it makes ulcerative colitis worse. So if you have bleeding, you can't give buttermilk. So basically, you have this khichdi diet 3 times a day with sweet, soft fruit in between the meal, with very bland spices and soft cooked vegetables and khichdi. That's it. It's a survival diet. It's not that tasty, and unfortunately, that is why most people quit it early and go out to a restaurant and overeat, and then they come back with a condition. So reoccurrence, we should say. So let's talk about, and of course, digestion is a big factor here. Many people have digestive problems and they're not really aware that they even have them. So in IBS, we still have to improve the digestion. There's many objectives here. We make that diet, so survival diet doesn't really cure the condition. It just avoids the pain and keeps them eating. And many people do come to something very similar on this diet. They usually don't get the mung dal, but they start realizing spices, cabbage, tomatoes, raw vegetables get them. and beans. So they generally, a lot of people, if they've had it for 10 years, they figure that out. It's called the hard way of learning, but people do it. It's kind of a little trial and error, a little Facebook, and they figure out beans are bad, spices are bad, raw vegetables are bad. Many people make it that far. And they can even get to the point where they can manage it, but they're on a very restrictive diet. They're often losing weight. They're still eating meat, which, including chicken and fish, will not allow this condition to heal. So they're only partly there, and they're not treating it. They're just kind of avoiding. They're usually so paranoid about dairy, they're not having any butter, and butter actually, ghee in particular, helps the condition. And buttermilk can actually help with replenishing the intestinal flora, but most people are too scared of having any dairy, even though if you know what you're doing, it could help this condition. So that's where I find most people in this kind of depleted, underweight, highly restrictive diet, and confused what to do, and no real ability to heal it. And they can be in this stage for years where they're just, barely getting by, 100 pounds, 105 pounds, still getting pain, can't eat anything. And it's very disturbing to many people. And that's how I get them. So you have to be very tricky. It's a very tricky condition to treat. So you have to be very sensitive, and you have to really kind of tune into the individual and know the degree in which they have this condition, what stage they're at, because you don't want to give them too restrictive of a diet if it's not necessary. So let me just talk about some of the herbal products, which are really necessary. I just couldn't even treat it without the herbal products. I've met people while traveling in Dubai and overseas, and I didn't have my herbs, so I put them on the diet. And then when I got back, then I could send them the herbs. But, the diet just throws them in limbo and stops them from having pain if you get that right, and keeps them from losing weight. And then you can't treat it without the herbs. I've seen people on the diet for years, and it just does not seem to be enough to heal it if it's quite advanced. If it's early stage, it's possible. So we have to get the diet stronger without aggravating it. So sometimes I'll give them this tea to sip with a meal, gently strengthens digestion before meals. And we can see this is a very mild tea. We can give it to babies for colic. Fennel, coriander, cumin, not even that much cumin, cinnamon, cardamom, and spearmint. Sometimes I'll make this for a person, it can still be too strong. So I take out the cumin and just leave in the fennel and the coriander and the cardamom. I can modify it to make it more gentle, and they'll sip that with the meals. If they're having a lot of abdominal pain with every meal, then, of course, we have a formula for that. It's also good for stomach ulcers, like the one case I showed you. She had a stomach ulcer and IBS, so we gave her this right after meals. So that helped with the stomach ulcer, soothe the intestinal lining. That's how they're getting this fast results in just a couple days, is a formula like this. But Guduchi is an anti-inflammatory, balancing all three doshas, particularly Pitta. But Shankbhasma, very few people even know it, only used in northern India. And it's like a powder and it's like an antacid, so it's putting out the acid. So it's actually a very simple formula, but very effective. Now, if they have no appetite and they're having loose stools, see, remember there's all these different case stages and types. So if they're having no appetite plus diarrhea, then we actually have a formula, IBS formula, but it does say diarrhea and IBS. So if they're constipated, we don't really use this. This helps with excess bowel movements, and there is like actual bamboo in it, and there's pomegranate skin. There's sugar cane in it, and there's a few mild spices to stimulate the digestion. And this is taken before meals. I think half to 1 teaspoon is a bit too much. It should be more like a half teaspoon before meals. And this is to stimulate the digestion and get control of that loose stools. Very few people have even had to need more than 1 jar, because you're following a diet plus taking that herbs. So you have to have the person hungry. If they're very hungry, these pre-digestive aids are not as necessary. They got a good appetite. But if they're not even hungry at all, then you need something to get the appetite going. One of my wonderful but simple products I have here that has helped me a lot, that I made myself. It's a very simple formula, really, but we give it to them and have them drink it all during the day. soothing gut tea. This was made just for people with IBS, ulcerative colitis. And we can all I did was throw in a bunch of demulcent herbs, marshmallow root, slippery elm, threw in comfrey, helps heal the tissue. Licorice is kind of like a catalyst, making the herbs work together, but all four are demulcent. So they're, and you can see it says soothes the gut and used even for ulcers. And it's a prebiotic. It doesn't say there, but it's a prebiotic. It's creating the environment for the probiotics to live. So particularly if there was a history of radiation treatments and a lot of use of antibiotics, then we give them a probiotics plus the tea between the meals to start replenishing the intestinal lining. If they have mild constipation, it's very tricky. We have to get the bowels moving without, inflaming the condition. So what little trick is actually inner leaf or inner fillet aloe vera. Not the whole leaf, which is what you mostly have, but the inner fillet. But this only works if there's some constipation, mild constipation, because it's very gentle, anti-inflammatory, helps the colon heal. And, you drink about a quarter cup of this at night, it will get the bowels moving and not aggravate the condition. You can't use any strong laxatives or it makes it worse. Another tea I use I pick usually one or two of these teas for every case, and as they go along, I could be changing them. But I've used this one's good for spastic colon, abdominal pain, particularly if there's more heartburn, acidity than there is irritable bowel, because they too can go together. And you can see there's some demulcents in there as well, marshmallow root and fennel. But we have this cat's claw, which is an anti-inflammatory, meadowsweet anti-inflammatory, chamomile is anti-spasmodic, and lemon balm is a digestive, cardamom herb, and coriander and fennel also for the digestion. Alfalfa is alkalining. It's very effective, reduces abdominal pain, inflammation, heartburn, and acid reflux. So if they've got acid reflux, heartburn, plus IBS, then I will use that one. If they're having more dry, hard stools and it's hurting while they're passing, but no, then I will use more this one, because those are also mild laxatives, that slippery elm. If they have no appetite at all, then I will usually, and constipation, I'll use this one to get the appetite going. If they have no appetite and diarrhea, then I'll use this one, as I mentioned. Then there is the main formula here, which is usually at the second stage. So that's the first stage. Put them on the diet, get the abdominal pain down. There may be even a digestive aid I give them after the meal, abdominal pain. I also have a colon formula called Pitacolin #1 for loose stools, not quite diarrhea, so they may give them that at night. But then once they kind of got it stabilized, then I go to the second stage and I give them this formula right here, which is really quite a tricky formula. There we go. Healing gut formula. There we go. Reduces intestinal inflammation. This is the big winner here. Heals the GI tract. And, it says 2 teaspoons in a cup of boiling water between meals mostly, or sometimes after meals, in coconut water. Very cool. And coconut water is used. Arjuna helps tissue heal. Most Ayurvedic practitioners believe this is for, their circulation and cardiovascular problems, but it also helps the tissue heal. Bala means strength, so this helps build the tissue back. Bilva is used in diarrhea, but it's also very astringent and helps the colon tissue heal. Katuj is used also in loose stools, diarrhea, and helps the tissue heal. Bilva and Katuj are both used together for diarrhea. Kamaduta Ras is a basma formula, which is very cooling, taking down heat. Licorice and fennel are just there for the digestion. And there's the herb that very few people know, Lajalut. And Lajalut is a heavy demulcent. And when people mix it up, they sometimes complain that it looks like snot or something in there. And that's the Lajalut, even though it's only 5%. If you chew it in the whole mouth, it's like forms a big snot ball. But this Lajalut is super demulcent, and it coats it right away. It starts allowing the tissue to heal. And most people need to do 2, 3, 4 jars of this while following the diet over at least 3 to 4 weeks, sometimes even longer. And they can slowly expand the diet out as long as they're not doing the forbidden foods like chili peppers, hot spices, raw vegetables, tomatoes, and particularly raw cabbage family. And they're taking the herbs to keep the digestion strong. They're keeping the bowels, moving but not loose with maybe another formula. And they're taking the healing gut during the day. So most people, this goes on for a few months, and they're on the Mung Dal at least for a month. And then we start weaning them off, and we start making adjustments to the diet. And of course, I've had many people reorder, like I treated them for irritable bowel in the past. And then out of the blue, I get an order and they say, send me 1 jar of healing gut, send me 1 jar of soothing gut, send me 1 of the Pitta tea. So, they know what to do. They don't even do an appointment. They just reorder the whole package. Probably they don't want to tell me that they forgot everything I told them and ate bad food again or something. But I see it quite often. So I know that my old IBS clients are having reoccurrence. It's always better they do an appointment, but I see them reordering this package, and it even can be a couple of years between the appointment. So I can see that this person went 2-3 years, no problem, and now they're reordering the whole package again. So they're probably pulling up their notes, probably back to following the diet, and amazingly, at that point, they can treat it themselves. Unfortunately, these herbs, some of them are very rare, like Lajaloot's very hard to find. We have to fly it in DHL from India. And these formulas are quite tricky. And sometimes, we have many clients where we just customize it for them. So we make the formula, and then maybe the results are not what we want. Oh, it constipated them. So then we reduce the bilva down, because I know that's the one. Maybe it's 5%. I may take it down to 2-3%. The Katuj is like 10%. I may take it down to 5%. Or the other way, they're still getting loose stools, so then I'll increase that bilva. That's one common thing. Or they feel some type of burning or too hungry, and I'll reduce down some of the other more heating herbs. So I just reformulate it for them and make them their own custom formula. So we have many old IBS clients who say, oh, send me my custom formula. And we make it for them. We have a little surcharge for making a custom formula, but when you're in all that pain, people just want what worked before. So again, difficult to treat on your own, takes a lot of finesse. The whole diet, the herbs all just change every 2 weeks. Every 2 weeks, it just keeps changing until eventually you wean the person off of the herbs, and the diet they have to stay on for even longer to avoid any reoccurrence. So if you know somebody with this condition, I would just recommend them to watch the video, I guess, and then send them my way, because it's very difficult to treat on your own, and it's very depleting. Most of the cases I have, the people have already lost a lot of weight, very weak and depleted, and many of them even been to ER before, like the medical doctor. Some of them even have been taking the medication, been doing some diet, and it's not working, and it's just the way it is. If you're in the early stages, then it's even better to do an appointment. If you're just getting, oh, I can't eat wheat now, I get diarrhea if I have a yogurt, I can't eat bread now, I get diarrhea, oh, I'm getting alternating constipation, loose stools. Well, you better catch it in the early stage, because it's going to progress, particularly if you don't make big changes to your diet. And it's just, you don't want to learn trial and error. Most people who did figure out the diet majority on their own, they did a lot of trial and error. They just learned the hard way, what hurt, what was painful. And then some people have even written books thinking what they did was going to work for everybody. This is completely unprofessional to be having an experience of treating yourself and then believe that you have now the knowledge to treat everybody else. No. Even for myself, I've had dozens of cases, and I can still meet a case that's different than all my past cases. I am, of course, happy when I see a case that's very cut and dry and similar to what I've seen before, but it's not always the case. So really, it's so important, like all health conditions, to treat it in the early stages. Unfortunately, most people come to me as a last resort. I would rather people came to me first in many health conditions, but unfortunately, people use me as a last resort. I mean, even with blood pressure, I know people, they're taking 3 meds and they still can't get their blood pressure down. Then they come to me. But, you know, if they would have came in the early stages, then it's so much easier. Same with these psychotropical drugs that are for the mind. You know, there's a certain addiction and dependence that takes place, and it's hard to wean the people off of these slowly. But if they would have came in the very beginning, when they first had this mental imbalance or instability or anxiety or suicidal thoughts, or, you know, and we treated it right in the beginning. Of course, we're not removing all the causes could be in their life, but we're giving them something to keep them going that's not harmful or creating side effects. Then they can work through it. But unfortunately, again, like IBS, people wait until it's advanced. They've already tried everything else. They've done Facebook, they've tried diets, they've been to the doctor, they've tried meds, and, you know, now they're, you know, 99 pounds, losing weight, hardly can eat anything, and in pain. I've had some just sitting here crying during the appointments because they're so frustrated and pain, and it's been going on for so long. So if you know anybody like that, then you should really advise them to not procrastinate, not try to figure it out by themselves, not try to learn trial and error, but find somebody who has treated it successfully. And you really would have to be, I think only Ayurvedic diet can work. You have to be a good Ayurvedic practitioner and a very good herbalist. I mean, you could be herbalist of other system, but you'd have to be very good herbalist with a lot of herbs to treat it. So hope that helped you. Hope that gives you confidence. If you have this condition or you know somebody, I hope that gives you the confidence that it is treatable, as I believe in my experience, all conditions are treatable, that all of the healing herbs have been provided to us by the Creator, and herbalism is here as our natural medicine. You just need a messenger, somebody with the herbs and understanding of them to guide you through the healing process. Once again, folks, thank you very much. I appreciate your support. I appreciate you referring your friends and family. And most of all, God bless you.